Hello, my name is Vijay Bajaj from WCBF. I'm the Managing Director of the Process Improvement and Healthcare Division. I'm here today with Dr. Gary Kaplan, Chairman and CEO of the Virginia Mason Institute. He is one of our keynote speakers at the WCBF 11th Annual Lean Six Sigma in Healthcare Summit in New Orleans. Hi Gary, thank you for taking the time to talk to me. I'd like to first ask you, what is the Virginia Mason production system?
Well, Virginia Mason production system is what we call the Toyota production system applied to healthcare. And when I think about it, I think it's important to understand it as a management system that uses lean tools, what many know as lean tools, but also embraces major principles of large-scale change management, all of which I believe holistically is required in order to lead and create sustainable large-scale change in a healthcare delivery system. So those things, in addition to the technical methods using lean tools, include ensuring that critical mass feels urgency for change, that there's a shared vision, that leaders, particularly physician leaders, move from their role as advocacy leaders to change sponsors, and then finally that expectations are all aligned. All of those things together comprise what we think about it when we think about the Virginia Mason production system.
Okay, excellent. What results have you achieved to date?
Well, we've been at it now, as you know, for almost 11 years,
yes.
And I think changes and improvements and results are really everywhere.
Yes.
They are in our so-called white-collar back office functions, whether it be revenue cycle and claims processing, whether it's in our IT work or supply chain,
yes.
Significantly reduced inventory, increased inventory turns,
yes.
increased point-of-use supplies. That's in those dimensions, but also change and improvement results of significance across the enterprise in inpatient care,
yes.
Whether it's getting close to zero in pressure ulcers or
yes.
central line infections or ventilator-acquired pneumonia,
yes.
the time nurses spend with patients at the bedside approaching 90% consistently,
yes. Yes.
For nurses across the inpatient facilities.
Yes.
In addition, changes in the ambulatory care
yes.
settings.
Yes.
So as a primary care physician, realizing that I can actually see more patients,
yes.
spend more time with patients,
yes. Yes.
shorten the amount of time they're in the clinic in aggregate, and get home for dinner with my work completed. Those are major breakthroughs and major improvements.
Results across the board.
Right. In addition, we've seen capital savings in how we design and plan new facilities, and even take facilities that we thought we needed and not build them because of our ability to better use our existing facilities in that preserving precious capital for mission critical and needed projects. So lots of results really in all domains within the healthcare system.
Right, okay. What challenges do you still face?
Oh, I think that this is a journey. I think it really never ends. I think one of the key principles of the Toyota production system and the Virginia Mason production system is constant pursuit of perfection.
Yes.
And so believing that perfection is possible, and knowing that it's going to take constant, never-ending pursuit to get there, suggests that we have lots of challenges. I think there's still many challenges around sustainability, reliability, and we've done over 1,200 improvement projects over the last decade, and I wish we had done twice that number.
Yes,
and so the opportunities are many. I think much of the low-hanging fruit has been addressed, but the deeper we go, the more opportunity we find.
Right. What are the leadership behaviors and structures needed to achieve this management methodology?
Well, I think what's critically important is to realize that this work is everybody's work, and has to be embraced, and in some ways start with the most senior leaders.
Yes.
At Virginia Mason, we said we need to change the minds of our leaders before we can expect that middle management or frontline staff are actually going to move forward in a concerted effort to change our organization. And so leadership behaviors are critical. As leaders, we have tremendous power and tremendous influence that unfortunately we rarely leverage in order to see process improvement and lead large-scale change. So as leaders, we've had to change the way we think. We've had to understand our presence on the Gemba, on the floor is critically important. We no longer can lead from our offices. We no longer spend our time reading spreadsheets and reports, but need to be out on the Gemba leading, articulating our shared vision, and really functioning in many ways as coaches, as teachers, as guides, as opposed to problem solvers. Historically in healthcare, the best leaders have been those who could swoop in. We call them the capes. They wear the capes, Superman capes, and they come in and solve the problems. Today, that's not what leadership's all about. It's about helping to build that capacity, build the will, and guide others in the organization to making the kinds of necessary improvements that our patients are counting on us to deliver.
How do you assess your organization's readiness to transform?
Well, I think there are certain indicators of readiness, but even without those, I think part of our job as leaders is to help create that readiness, not shy away from telling the truth, create urgency, not manufacture it, but just shine a bright light on all of the reasons that these kinds of changes are critical. And then I think you can begin to see when you have critical mass of people pulling change, wanting to improve, then I think you know that you are ready to really accelerate the work.
What are the biggest cultural challenges of lean implementation?
The biggest challenge is the fact that we are acculturated as healthcare professionals a certain way, and unfortunately that acculturation process continues today and hasn't really changed in the last century. 100 years or more, we've been trained and acculturated the same way. That culture leads to a high priority on autonomy, not just physician autonomy, but nursing autonomy, as well as others. Those changes, that attribute is not consistent with teamwork, collaboration, the kinds of things that we know we need going forward, skill task alignment. And so we need to be willing to address those deep-seated assumptions that really help to comprise the culture. We need to confront those head on. And at the end of the day, it's the leaders' behaviors that most significantly impact culture. And so as we look to ourselves and how do we change our work, how do we change our thinking, and then how do we signal those changes outward to the entire organization, it's through those actions that we're going to be able to move the culture in the direction it needs to go.
Every year we conduct a survey of over 6,700 hospitals, and we ask them who are the top 5 lean deployers. And your name, Virginia Mason, consistently comes in the top 5. Why do you think that is? What is your differentiation?
Well, I think we've approached this as a management system, which means that nobody can opt out. And so what our whole management system, what our daily work life is about, is deploying these methods and this culture ever more deeply so that we can transform healthcare, so that we can actually take the waste out of processes, create a high reliability organization, help to create a high reliability industry. We take this obligation seriously. We're not going to slow down. In fact, we're going to accelerate our work as we form the Virginia Mason Institute. One of the questions was, well, as we share this, people are going to catch up. And we say, that's great. We're raising the bar for everybody. And like they say at Toyota, they can chase our taillights because we just want to move faster. We just want to keep showing what's possible. And if we do that, patients in our community, but not just in our community, patients everywhere are going to benefit. So that's what drives us, and I think that's what helps us stay in the leadership role that we've been fortunate to be in around this work.
What do you do when your folks don't align to your lean methods?
Well, as I said, this is a management system. It's a way of life at Virginia Mason. Was not always the case, and we've had, the early adopters, but then we had the people who did not want to go there. My goal is to help bring everybody along. Unfortunately, we realized that not everybody could come. And what we say is that not everybody has to be a zealot, not everybody has to be a champion, but you can't be a barrier. When a work unit designs themselves standard work to take out the waste, improve reliability, improve quality of safety, and lower costs, you can, as a single individual, you cannot opt out, and because that's a barrier. If one person opts out of the standard work, you actually create a defect-prone situation. That's not what our patients want, and not what our patients have come to expect. And so, there's a spread within the organization, and yet we've moved the curve, far along, so that at a minimum, everybody understands the methods, tools, everybody's trained. It's not optional.
What are the most prevailing issues in implementing lean?
Oh, there are many. I think a couple things I would mention is the engagement and role of leadership, a critical success factor. Without it, the work will be sub-optimized and never penetrate deeply in the organization. I think that's one. I also think that audit and accountability are critical, ensuring that you actually stay the course. Not every workshop leads to sustainable improvements, but you need to know where they're sustainable, where they're not. And when it's not been sustained, we need to understand why. And so a lot of people dread that word audit. It sounds like the Internal Revenue Service is going to come visit us. But really it's just about holding ourselves accountable to do what we say we're going to do. And so I think that's critical to deployment and then sustainability as well.
How are you prepared for Obamacare?
Well, I think that this work is exquisitely prepares us for whatever comes next. The Accountable Care Act has many things in it that we think are good and conducive to improvement, conducive to improving quality and lowering costs. I think this work says we're going to work on the cost of production and however we get paid in the future, and whatever the regulatory environment, we're going to do it from a position of strength. We're going to do it from a focus that's consistently improving quality, safety, and consistently taking out waste and allowing us to be the highest quality provider at the most affordable cost.
Right. And final question, what value do you see in an event like this?
Well, I think it's great for people to come together and learn together. I think no matter how far along one is in their journey, there's so much more to learn. And I think we need to be willing to open our eyes and learn from others' experiences inside and outside of healthcare. And so conferences like this serve a great convening function and get people together, create that synergy, those relationships that carry over far beyond the actual conference itself.
Great.
Thank you
Thank you very much.
Thank you.